Hello everyone, my name is Shamayah Revis, and there's my picture, and I will be doing my presentation on the therapist's perspective on providing COVID-19 education. So I'm going to start with the background. There has been an increased concern for the mental health of individuals living in low-income and minority communities. Fear, worry, and stress are normal responses recognized when individuals are faced with uncertainty or the unknown. Elevated levels of adverse mental health conditions were reported by adults in the U.S. in June 2020, according to the CDC. Through a community academic partnership, it was recognized that individuals and families of minority communities that suffer from mental illness have a greater need for integrated behavioral and physical health support. For this reason, an educational intervention on COVID-19 was created for mental health therapists to facilitate with their clients. So the purpose of this research study is to understand the challenges and facilitators that therapists from a community mental health center are experiencing while providing COVID-19 education and guidance to their clients. Now I'm going to review the categories and methods used in this study. So the research setting is within a mental health clinic network, which is located in underserved communities of color. They serve 1,100 patients, about 60% of which are children and 40% are adults. There are 80 therapists who were trained to conduct the COVID educational intervention with their clients. This intervention includes 4 sessions covering COVID symptoms, prevention, testing, vaccination, household planning, and physical and mental well-being. The educational intervention is geared towards adults, meaning adult caregivers of child clients, and adult clients will be targeted. So for the study's design, this is a pilot study of a COVID-19 educational intervention within a mental health practice. A training evaluation was collected in January, and the educational intervention is currently being performed. 4 focus groups will be conducted in May, and this study will be analyzed from the qualitative data using the grounded theory approach, and this will be to determine the major themes found. Now I will be reviewing the preliminary results. A survey was given to therapists after participating in the COVID-19 education staff training session. As you can see demonstrated on this slide, both graphs are skewed positively for therapists feeling as if their clients will benefit from what they learned and they will be able to apply what they learned. Here we have a quote regarding strengths in learning the COVID-19 educational intervention, and it stated, "I really enjoy linking it specifically to our clients and how we could share information to them. I appreciated the presentations that were relatable, easy to follow, and applicable." Challenges include this representative quote that stated, "It was difficult to follow some of the very scientific presentation as we are not very knowledgeable in this area." From this particular feedback, we can understand that integrating physical and mental health can be quite a challenge for the therapist, which is why it is so important for us to find out what would best support these mental health workers during these strenuous times. Now I'm going to discuss some anticipated results we expect to see after delivering the focus groups. Based on the preliminary results previously described, we anticipate that the focus groups will display a range of facilitators and barriers that the therapists are experiencing in providing COVID education and guidance using the educational intervention. Some potential facilitators can include the trust in relationships and cultural inclusivity already established with their clients. Some potential barriers can include the client's mental capacity, the therapist's personal and client views about COVID-19, and public uncertainties about COVID-19. The future direction of this research study will be to use the results from these focus groups to understand the need to further the spread of information learned in the COVID educational intervention. We will also spread awareness about the importance of having better integration of physical and mental health practice. This COVID-19 educational intervention will serve as a framework to help mental health providers best support their clients during this pandemic and any future ones to come. Thank you for listening.